I'm Dr. Owen McGonigle from Bluegrass Orthopaedics. I specialize in sports medicine. The hip labrum is a tissue that is nearly circumferential around the socket of the hip joint. It functions to stabilize the hip joint and has a suction cup effect for keeping the hip stable within the socket. In people where this tears, it can lead to small microinstability and, more importantly, to pain. Most people with hip labral tears present with pain deep down in the hip. Usually it's something that they cannot put a finger on. Most people will describe pain that's more towards the front of the hip than to the sides, but some people will present with pain that even wraps around towards the back or the buttocks area. Pain tends to be worse with increased activity in general. A lot of people will describe symptoms of clicking or catching deep down in the hip joint. And certain activities with twisting seems to bring it on as well, such as classically twisting the hip and foot to get in and out of a car, for example. The hip labrum can tear for several different reasons. Many times there are bony abnormalities or growths which may lead to pinching between the labrum and a portion of bone around the hip. Some people are very active and have extremes of motion which may lead to the hip labrum pinching, such as in dancers or hockey goalies, which causes a repetitive trauma to the labrum to cause it to tear over time. Treatment of hip labral tears, like most injuries, start with a conservative approach. Activity modification and physical therapy to strengthen and stretch the muscles around the hip is the first choice. In patients for which that's not successful, typically need further imaging, such as an MRI and X-rays, in order to further evaluate for the presence of a hip labral tear. Ultimately, those who fail the non-operative treatments can go on to need a hip arthroscopy procedure to both treat the labral tearing, to fix that, as well as to treat any associated bony abnormalities which likely were the underlying source of the tear and potentially could cause a re-tear in the future if not addressed. If you're interested in coming and talking to me about hip pain or any other issues, please feel free to reach out, call the office to make an appointment and see me at Bluegrass Orthopaedics.